Namaste and welcome to the next episode of Clinical Ayurved. Myself, Dr. Mayuresh Agte. We have started discussion on the Annavasratas Vyadi, and in that regards, we have discussed Trishna Aruchi Mukhabat. Now we will move towards another Vyadi which is very simple for diagnosis and also for the treatment, and it is the Chardi. Very easy for diagnosis. Patient himself tells that there is vomiting or there is vomiting sensation, something is trying to come out of the mouth, etc. So vomiting or chhardi is easy for the diagnosis, and also we all know the treatment is also simple. We will discuss it afterwards. Then what point I am going to tell today on the topic of the chardi, which is a totally different topic or different thinking. Now, taking this example of chardi, we can imagine the thinking process of the Granthakar. I will explain you what I mean it. All of us know in the Sampratya of the Chardi, what they have written in almost all Granthas, there is Uddirana of dosha in the Amashay. Udan Vayu gets Prakupit, and Gati of Udan Vayu is Urdhva Gati. So, this Prakupit Udan Vayu, by its Urdhva Gati, expels the content in the Amashay. It may be a pitta, it may be a food, it may be only a watery content. Whatever it is, water there is udiran in the amashay gets expelled out forcefully by udan vayu, and all of us know this is the this samprati is written by almost all granth. Only Sushrut Samhita, in Sushrut Samhita, Sushrut Acharya has particularly given one addition in this samprati. What he has said? He has said Udano Vyana Sangata. In other Granthakar tell the samprapti, Udan Prakupit and expels everything from the Amashay, and it is thus called a Chardi. No one has mentioned Vyan Vayu in this samprapti, but only Sushrut in Sushrut Samhita, Sushrutacharya has mentioned specifically Udano Vyana Sangata. Now, from where this Vyan was added by Sushrutacharya is the beauty of the thinking of the Granthakar. When you go with the types of the Chardi, it is Doshaja type, Vataja, Pittaja, Kaphaja, and there is another specific type which is also seen clinically, Dvishtartha Chardi. Dvishtarthaja means any Indriyartha which are not good for the body, bad smell, bad food, bad taste, everything. And because of that Dvishtarthaja, that bad artha of the indriya, patient gets vomiting sensation. Now, what happens in other chardi prakar? There is some sanchaya prakop prasaravastha, and then there is something is collected in the amashay, and then doshudiran, udan prakupit, and then it expels from the mouth. All these things, sanchaya prakop prasar, take at least some time to happen. This Sanchaya Prakop Prasar Vyakti, all these Samprapti steps take at least some time to happen in the body. If you take the food, it does not happen that you get immediate result of the chardi. If there is ajirana, etc., there is lots of food, patient eats continuously eating of the food, etc., etc., whatever hetu are there, they take some time to make the samprapti at actual. Okay, What happens in the Dushta Chardi? If you are going on the road and you get some rotten food smell, or you eat some rotten food, the body reacts immediately. If you take some very bad smell, something has been some animal is died, and that the smell of the that dead animal goes inside your as an indriyartha, and you immediately feel like vomiting sensation. It's a common experience of all of us. So specifically in the case of Dvishtarthaya Chardi, all these things, Sanchaya Prakop Prasar, happen so quickly in the very short time, or you can say no time, and patient feels the vomiting sensation and may start vomiting immediately. You know, this is all our common experience. In practice, in today's era also, you will find mostly, I am not claiming every time, but mostly when such symptom which get uh, we see in the patient instantly, spontaneously, the patient runs to the hospital because he was normal at present and now he suddenly started vomiting. So patient gets frightened and goes to the hospital immediately, because as I said, there is very shorter time where the samprati has happened and the symptom has started in the patient. And most of the time, the surgeons face these problems of the emergency. Most of the times, I am not claiming every time. In case of cardiac problem, etc., you will find physician. But most of the time, as compared to other branches, surgeon gets more face to face to the emergencies. Now what is the case? Patient's relative say he was normal, we are walking around and we started he, some smell went and he started huge vomiting after the smell. As a surgeon, this is my logic, as a surgeon, when Sushrutacharya has seen such patients, he must have taken the history of the every patient in the detail, and then he may came to the conclusion that Dvishtatva Chardi, it means the artha was not good for the body, not good for the mind. Hrudayam Manasya Sthanam, so it was bad for the heart also, because the Indriyartha was not proper, and in the Hrudaya there is a Vyana Vayu Upasthiti. So this samprati of Dvishtartha Chardi, there must be involvement of Vyana Vayu also along with Udan Vayu, and hence only Sushru Samhita, as a surgeon who has faced emergencies most of the time than other branches. Again, I am not claiming that he has only faced, but comparatively, after taking such patients, seeing the such patients which has started sudden vomiting, and in the hetu he must have find that there is Dishtarthaja, improper Indriyartha, that went to Mana, and there was not good for the Mana, a Manasatva, Hrudaya Sthan, Sthan of Mana is Hrudaya, and in Hrudaya there is Vyana which also has get Prakupit along with Udan. Hence, only Sushru Samhita mentions that there is Udano Vyana Sangata. I have taken this example purposefully because always remember, every Granthakar has their some frame of mind and they have stated the samprati or their conclusions on their experiences and their frame of mind. In Sushrut, he was a surgeon, and hence the patient seen by him, he has concluded in the Grantha according to experiences he has seen. Same to all Grantha. Hence, you will find in many Samprapti, though Charak is the greatest physician, Sushruta Samhita Samprapti or his all discussion about diseases are far more superior. So this is the example which I purposely took for this angle of the Granthakar. Thank you very much. We will discuss Chardi topic Chikitsa as such in the next episode. Thank you very much.